Good evening, all, once again, and welcome to Sinan's monthly lecture health series. And this evening will be our very own Dr. Rhodesha Wright, who will be presenting on hypertension or high blood pressure. But before she comes, we'll open with a word of prayer. So we'll ask the rector, Father Hugh Bartlett, to please open with a word of prayer. Shall we pray?
Heavenly Father, we give you thanks for this occasion and we ask your many blessing on the initiation of this ministry of healthcare and its lecture, informing us, dear Lord God, of better ways to look after ourselves. We thank you most especially tonight for Rhodesia and all who would have planned this session tonight. We just give you thanks and ask your blessing on our proceedings. In Jesus' name, amen.
Okay, sorry about that. I was trying to unmute the mic. Good evening, everyone. Thank you all who came this evening. Thank you for Bartlett for starting us off with an opening prayer. So I'll jump right in. It's just a little bit of a background about me. I was born in Nassau, Bahamas to parents Roderick and Psyche Wright. Attended St. Augustine's College, where I got my secondary school education before going on to the College of the Bahamas, which is now the University of the Bahamas, where I obtained my biology with a minor in chemistry, Bachelor of Science degree. I furthered my education at the University of the West Indies in Trinidad, where I got my medical degree. And I'm currently employed as a senior house officer at the Ministry of Health and Wellness. And this evening, I'm Dr. Rhodesha Wright. I will be presenting to you on hypertension. By the end of this presentation, we'd like to cover the following topics. What is hypertension? What are the types? What are the symptoms? How is it diagnosed? What are the risk factors? What are some of the complications? And how is it treated? So we'll jump right into it. Blood pressure is essentially the pressure of the blood as it pushes against the walls of the blood vessel. It's measured using a manual or a digital blood pressure monitor. And when the blood pressure reading is done, you see two numbers. So if you look in the bottom right of your screen, you would see 120 over 80. 120 represents your systolic blood pressure, which is the top number, and it's essentially the pressure in your blood vessels when your heart is beating. The bottom number is the diastolic blood pressure, and that is the pressure in your blood vessels when your heart is resting in between beats. When blood pressure is persistently elevated, it is known as a medical condition called hypertension. There are many guidelines to determine what is considered to be hypertension. The American College of Cardiology and the American Heart Association uses hypertension guidelines that defines normal blood pressure as a systolic of less than 120 and a diastolic of less than 1. And that's the bottom over 120 over 80. Elevated blood pressure is considered to have a systolic blood pressure of 120 to 129 millimeters of mercury, and the diastolic is still below 80 millimeters of mercury. Hypertension now is defined as systolic blood pressure greater than 130 to 139 millimeters of mercury, or a diastolic blood pressure between 80 to 89 millimeters of mercury. Stage 2 hypertension is when the systolic blood pressure is at least 140 over a diastolic blood pressure of 90 millimeters of mercury. Now, in some cases, patients may have a difference in their staging, meaning that the top or systolic number may fall into the normal range. For example, it might be 118, whereas the bottom number might be high. So the diastolic blood pressure may be 95. In cases like that, the higher value would be used to determine the stage of the person's blood pressure. So that the person will actually fall into a stage 2 category for their blood pressure. Other countries may have different guidelines that they follow. For example, Europe has their own guidelines for the European medical associations. So this is just a summary representing, I just said, normal blood pressure is less than 120 over 80. Elevated blood pressure is between 120 to 129 over less than 80. Hypertension stage 1 is 130 to 139, or 80 over 80 to 89. And hypertension stage 2 is greater than 140 or greater than 90. Other terms that may come up are isolated systolic hypertension. That's what we mentioned earlier, whether there be some differences in the systolic and diastolic reading. So with isolated hypertension, systolic hypertension, blood pressure systolic may be greater than 130, whereas the diastolic blood pressure may still fall into the normal category of less than 80. In isolated diastolic hypertension, the blood pressure systolic may be less than 130, whereas the diastolic may be elevated at greater than 80. And in some cases, patients may have a mixed systolic diastolic hypertension where both readings are in fact elevated. In some cases, patients may have what we call white coat hypertension. And for some patients, when they go to the doctor, they become anxious, they become nervous, and as a result, their blood pressure readings would go up. So their blood pressure would be consistently elevated in the office, but it does not meet diagnostic criteria for hypertension based upon code of office readings. That means that a patient may come in to the doctor and their blood pressure is always high, but you would find when they're home, their blood pressure would be within normal range. And on the opposite end of that, there's masked hypertension. With masked hypertension, the patient now would have consistently elevated blood pressure out of the office, but when they're in office, they would have normal blood pressures based on the guidelines we talked about earlier. Some groups are more at risk for developing high blood pressure. For example, rates are highest in those of African descent. There's a higher prevalence of high blood pressure in patients who are overweight and obese. And before the age of 65, males tend to have a higher rate of high blood pressure versus females, and that changes after the age of 65. After menopause, women in general tend to have a higher risk of developing high blood pressure. So what are the types of high blood pressure or hypertension? There are two main types: primary hypertension and secondary hypertension. In the past, primary hypertension was once known as essential hypertension, and the essential or primary hypertension has no identifiable cause. It's likely caused by genetic or environmental factors that we'll speak about a little later. Whereas secondary hypertension, on the other hand, has an identifiable cause, and it's usually another underlying medical condition. For example, some patients may have a very rare tumor that's called a pheochromocytoma, where they might have episodes of their pressure being extremely high and then it might go down. But that's just one example. Other causes of secondary hypertension could be illicit drug use. Cocaine could result in a patient developing high blood pressure. And in some cases, even prescription medication with prolonged use may eventually lead to a patient developing high blood pressure. Example, birth control pills that are high in a particular hormone called estrogen, that can lead to it, as well as NSAIDs, non-steroidal anti-inflammatory drugs like aspirin and ibuprofen eventually may also lead to a person developing high blood pressure. So we mentioned earlier that there are some environmental factors that may predispose a person to developing high blood pressure. And this would basically fall into risk factor category. So we have two types of risk factors that will contribute to a patient developing high blood pressure. The first is the non-modifiable risk factors. Now, these are the things we cannot do anything about. People can't change their age, they can't change their genetic history, they cannot change their race. So with advancing age, patients tend to have an increase in blood pressure, especially the systolic blood pressure that would usually raise as the person increases with age. Family history is another important non-modifiable risk factor. Studies have shown that patients who have at least one or even both family members who are hypertensive, they have a higher risk of developing hypertension in comparison to a person who has a family member who's non-hypertensive. And it also shows that there's about 30% variation based on family history for the development of high blood pressure. Race is another important risk factor. As we mentioned earlier, hypertension is more common in those of African descent. Not only is it more common, but it tends to be more severe. It tends to occur early in life, and it also tends to result in more serious complications. The second group that is prone to hypertension would be those of Caucasian descent, and the risk is actually lowest in those of the Asian race. So on the other end, we have modifiable risk factors. Modifiable risk factors are things that we actually can control. And as Bahamians, we like our well-seasoned food, and sometimes it might be well-seasoned, but it might be salty. So high sodium actually contributes to developing high blood pressure. And ideally, patients should not intake more than 3 grams of sodium per day, because that will increase the risk of developing pressure. The greatest modifiable risk factor is actually obesity. Obesity and weight gain are hand in hand with developing cardiovascular complications that we'll talk about a little later. Excessive alcohol intake may also contribute to the development of hypertension. And physical inactivity. So those who have a sedentary lifestyle where they are basically just sitting down all day, in the age of technology, we have everything is so convenient. People don't really move about as they would have without the comforts of modern technology. So all of those actually play a role in how a patient will develop hypertension. So what are the symptoms that you look for in a person who is hypertensive? Some of you may have heard that hypertension is known as the silent killer. And the reason why it's called this is because patients are usually asymptomatic until the blood pressure is so severe that it actually damages your organs. But in some cases, patients may complain about having a headache. They may complain about dizziness or chest discomfort. But these are all non-specific symptoms, meaning that those can be symptoms of any disease. It doesn't necessarily mean the person is having a headache because, oh, my blood pressure is high. So the only true way to diagnose it is through doing consistent blood pressure measurements. And if the blood pressure is extremely high, there might be damage to organs such as the kidneys, the brain, the heart, even the eyes can be damaged from blood pressure being too high. So how is it diagnosed? Hypertension is suspected if in-office blood pressure is persistently elevated on 2 or more separate occasions, and it is then confirmed by out-of-office measurements. And further diagnostic measures may be done to basically confirm that the person is having high blood pressure. And this might include doing a cardiovascular assessment, meaning that the doctor may go in and determine if the patient has any of those risk factors we talked about earlier. And there are various tools that can be used to determine whether or not this person may, in fact, develop perhaps a heart attack in the next maybe 10 years or even a stroke based on these risk factors. Other blood testing may be done or imaging to check if there's any organ damage. And all of these factors come together to diagnose a person with hypertension. So it's important that blood pressure is monitored, and patients can actually monitor their blood pressure at home. But there are a few important things to do it the correct way. It's very important for the patient to adequately prepare, and that means avoiding caffeine, smoking, and exercising for at least 30 minutes prior to a blood pressure reading. They should also wait for at least 30 minutes after a meal. If they are, in fact, on blood pressure medication, the blood pressure should be measured before taking the medication. And this prevents false readings because, the blood pressure medications will alter the pressure. It's also important for them to be seated comfortably and quietly in a quiet area without distraction and to empty their blood beforehand. Once they are properly prepared, it's important that they are properly positioned. So as you can see here, we have a lady sitting down in a chair. Her back is resting against the chair. The chair has a nice firm back. Her legs are planted flat on the ground. Her ankles are not crossed. Her knees are not crossed. Her arm is resting on the table, and it's elevated to the level of the chest, which is at the heart level. And the cuff is placed directly onto her skin with no clothing between the cuff and the skin. It's above the elbow and it's at mid-arm. Now, cuff size also may make a difference in terms of getting accurate blood pressure reading. So the cuff size should be used based on the person's arm size. After all of these things are done, the patient should be allowed to rest for at least 5 minutes while seated in this position. And if they're doing blood pressure measurements at home, ideally they should take 2 or 3 measurements, at least 1 minute apart, twice daily for 7 days to get the reading. Record these, and then this could be used to help your doctor determine if you indeed do have high blood pressure. So you were diagnosed with high blood pressure. What are some of the complications that may occur? One of the main organs that can be damaged by blood pressure is actually your heart. Think of your blood vessels as you can pull that elastic, you can manipulate that elastic, pull that, and pops right back. Your blood vessel has that same elasticity where it's able to basically maneuver with the blood. High blood pressure eventually would lead to loss of that elasticity of the blood vessels, and they become stiff. As they stiffen, it's more difficult for the blood to get to the heart. And blood is actually carries oxygen to the heart. So with decreased blood flow, you have decreased oxygen getting to your heart. Some of the things that may result because of this would be angina. There are different types of angina, but basically angina is chest pain that's caused by a reduction in blood flow to the heart too. Heart attack is another life-threatening condition where a person can have death of the heart muscle due to a lack of blood flow and ultimately a lack of oxygen in that area of the heart. Another condition that may occur is heart failure. And heart failure is essentially when the heart is unable to pump blood through the body. And this would result in a buildup of blood in the heart, and eventually fluid buildup because the heart isn't pumping as it should. And in severe cases, these patients can have swelling of their legs. They could have swelling as far as up to their waist. And in really severe cases, they might have swelling all over and even fluid buildup in the lungs. So you can see why damage to the heart is one of the more serious complications of high blood pressure. Stroke is another important complication, stroke and brain problems in general. So again, blood carries oxygen, to the organ. So when there is a stroke, brain cells would usually die, and that may result in speech and movement disabilities. And the stroke could be caused by either the blood pressure is so high that the blood vessel may actually rupture, or there might be a blockage which would cause the blood to not be able to get to that particular part of the brain. Dementia is another common complication of hypertension. So there is an increased risk of developing dementia in the elderly, especially in those who have high blood pressure in their middle age. And with dementia, they will eventually have difficulty with their cognitive function. So they might have problems with their memory. They may not be able to think as well as they would have earlier in their life. And then you have damage to the kidneys. So hypertension can also lead to damage of kidney function. And ultimately, the patient may eventually develop chronic kidney disease. And it goes through a few stages before kidney disease is so severe that it's end stage and the person will need dialysis. Not mentioned here on the slide, but should be noted that high blood pressure can also lead to rupture of vessels in the eye. So it can actually affect the eyes as well. So how do we manage hypertension? The main management would be lifestyle changes and medical management. And with both of those options, it's extremely important to maintain regular visits to the primary care physician, would monitor the blood pressure and make sure that whatever management option is working adequately for that particular person. So here are some lifestyle changes that can be done to reduce the risk of hypertension. First, the lifestyle changes are basically a reversal of the modifiable risk factors that we talked about earlier. So we mentioned that salt intake increases your risk of developing hypertension. And if there is a reduction in salt, then there can be a reduction in blood pressure. Smoking can also contribute, so you can stop or reduce your smoking intake, your smoking to reduce your blood pressure. Consuming a healthy diet is extremely important, and we'll talk about that in the next slide. Weight loss also helps with the reduction of blood pressure, because remember, obesity and being overweight was the #1 risk factor. So losing weight actually helps a lot in terms of changing or monitoring blood pressure. Alcohol intake should be reduced. Some studies have shown that women who consume 2 or more alcoholic beverages a day and men who consume 3 or more drinks per day have a significantly increased risk of hypertension. So in men and women, it is advised that men should consume no more than 2 beverages a day, and women should consume no more than 1 beverage a day, alcoholic beverage, that is. And we mentioned earlier that diet plays a role in controlling hypertension. So I don't know if any of you have heard about the DASH diet or know exactly what it is. The DASH diet is dietary approach to stop hypertension diet. And it includes foods that are rich in potassium, calcium, and magnesium. They're all good in terms of reducing hypertension. Studies have shown that the DASH diet can lower blood pressure in as little as 2 weeks. The diet is rich in fruits, vegetables, and whole grains, and it also limits foods that are rich or high in saturated fats. So this photo just shows an example of what the DASH diet is and what types of food should be eaten on the DASH diet. So the first category we have here are grains. Grains should be consumed 6 to 8 servings a day. Fruits and vegetables, they should both be consumed in at least 4 to 5 servings per day. Fat-free or low-dairy products should be consumed in 2 to 3 servings a day. Lean meats, poultry, and fish should be consumed in 6 1-ounce servings or even fewer daily. Nuts, seeds, and legumes in 4 to 5 servings weekly. Fats and oils in 2 to 3 servings daily. And sweets and added sugars should be consumed in 5 servings or fewer weekly. If the lifestyle modifications fail in reducing blood pressure, patients may require medication to manage their hypertension. So medical management is individualized and it occurs after a patient is properly assessed and their risk of end organ damage is evaluated. There are multiple guidelines that exist to help determine the best medical therapy for each patient. So we wouldn't go into all of that in this PowerPoint. Ultimate goal of treatment is to reduce the patient's risk of developing any severe cardiovascular risk and having any of those complications that we talked about earlier. So in summary, hypertension, also known as persistent high blood pressure, is a common medical condition in which blood pressure is higher than normal. There are 2 types of hypertension, primary and secondary. Hypertension is asymptomatic and known as the silent killer. Diagnosis is made when blood pressure readings are persistently elevated. Multiple risk factors contribute to the development of hypertension, and hypertension is treated with lifestyle changes or through medication. And that is my references. That brings us to the end of the presentation. Thank you all for tuning in. Any questions? We're opening up the floor for questions now.
Thank you so much, Dr. Wright. Thank you so much for that presentation. And yes, the floor is now open for questions. So feel free, parishioners, everybody who have a question, please ask it now. Thank you.
You can unmute yourself now.
Good evening. I came on a few minutes late on the presentation for the presentation. Dr. Wright, what I wanted to ask, when taking your blood pressure, is there any preferences with regards to which arm you use, whether it's the left arm or the right arm? I know some persons was telling me if you take your blood pressure on the left, which is closer to your heart, you get a high reading. Whereas if you take the right, you get a different reading. Can you elaborate on that for me, please?
Okay, thank you for your question. With the blood pressure measurement, so I have seen where studies actually there wasn't anything in terms of which arm is preferred for blood pressure measurements. However, I did come across in my reading that blood pressure, if there's sometimes there can be a difference, like you did mention, between the right and the left arm. A few things can cause that. In some cases, there can be atherosclerosis or the blood vessel is actually blocked up, which may present from fats in the blood vessel, and that might actually prevent the blood from flowing through that. If it's a huge discrepancy, then that can be a contributing factor as to why there's a difference in the arms. But in the reading, it said that if there is a discrepancy, usually you should continue to do the blood pressure monitoring in the arm that usually would give the highest pressure. So if you usually do in your left arm and you find that your left arm is always higher than the right, you should always take the blood pressure from your left arm. But in terms of it being closer to the heart and everything, no, I didn't come across anything like that in my routine.
Okay, thank you.
You're welcome. Any other questions?
Yes, the floor remains open for questions, so we'll have another 3 up to 5 minutes for questioning in if the questions keep flowing. If not, we'll just conclude and give the update for our next lecture. So please keep the questions coming. Thanks.
And doing your
Okay.
blood pressure,
First of
would
all, I'd like to say that was an excellent presentation. Sorry, was
Thank
someone
you.
else speaking?
oh, go ahead. Sorry, go ahead.
Gave you a very clear idea as to what to expect. My question is, if you've been prescribed medication, is there any way that you would be able to, after, say you've been on it for about 10 years, is there any way that you could ever come off of blood pressure medication?
Okay, thank you for your question. In some cases, in some people in general, in the Bahamian population, if someone is told that, okay, you have high blood pressure, you need to go on medication, it's always a resistance to say, I don't have pressure, I don't want to go on any medication, or they like to say, I'm not claiming that. But if someone goes on medication and they are on it long term and they make lifestyle changes, if they go to their doctor regularly, they are doing the medications as prescribed and taking it as it should be taken, and doing the lifestyle modifications. If the doctor sees that, okay, this blood pressure, the person is on this blood pressure medication and the readings are getting lower and lower, they might wean them off of it to where they would require a lower dose. And in some cases, they might discontinue the medication. But even if that is done, it still requires for the patient to have constant monitoring to make sure that they don't slip back into their old lifestyle habits and the blood pressure comes back. So it is possible. Somebody else was asking a question earlier as well.
You won't believe it, I was about to ask that same question.
Oh, okay.
Thanks.
Good evening. What is the view for persons who desire to take a medicinal route when combining the pharmaceutical drugs? What is advised?
Okay, thank you for your question. Good evening. When you say taking medicinal route, you mean in terms of like bush
Bush
medicine?
medicine, right?
Okay, so bush medicine, there isn't a lot of research. In the Bahamian population, we strongly hold firm to our belief that bush medicine is good. Some bush medicines they're good for different things. So they're just how they're good for different things. We don't know exactly what all they're good for, and we don't know exactly what all side effects they have. So with combining blood pressure medication and taking bush medicine, the blood pressure medication may become ineffective from the bush medicine. So that's one thing that can happen. The second thing that can happen with taking the bush medicine with the blood pressure medication is some of them actually can damage the liver. But there isn't much research out there to say, what dosage are you taking this bush medicine in? How often should you be taking it? What effect it has on what organ? So at this point, I would say that there just isn't enough research, but we know for sure that it does interact with medication, sometimes in a negative way.
Thank you.
Hi, good evening. A question, Dr. Wright. Let's say that you make the necessary lifestyle changes and you have a few blood pressure readings and it's below its normal. How often after that should you get blood pressure readings to ensure that you maintain normal pressure?
Good evening, and thank you for your question. If the lifestyle modifications do in fact reduce blood pressure, it's still important to follow up with regular visits to the doctor. So whoever the person is attending for their regular visits, they will determine how often this person needs to come in, and it may in fact be due to their risk factors. So if someone is doing the lifestyle changes and they still have, say, a family history or they fall into the African race, the doctor might require them to come in to monitor their pressure more frequently than, say, someone who has a lower risk factor, or they fall into the Asian race, or they had no family history of hypertension. Also, in terms of doing regular visits and annual checkups, blood pressures could be monitored at home. And it's actually advised that everyone tries to maintain or measure their blood pressure fairly frequently at home, at least if they're not on medication and just doing lifestyle changes, they should still try to be pretty frequent, a few times a week, in terms of measuring blood pressure. And they can be subjective in terms of saying, my blood pressure is climbing back up again. I need to make an appointment to go see my physician. But the physician may do it on a case-by-case basis.
Hi, good
Okay,
evening.
thank you.
You're welcome.
Good evening. Good presentation, but for the most part, I was having some internet connectivity, so I didn't hear much of it. Did you speak about having low blood pressure? And I'm wondering, is having low blood pressure, not normal blood pressure, but low blood pressure also critical?
Good evening. Thank you for your question. Having low blood pressure, or what we call hypotension, also comes with its own complications. In some cases, most people would have low blood pressure that is asymptomatic as well, similar to hypertension. But in those that are symptomatic, they would tend to they might feel dizzy, they might be having shortness of breath, they might even have like cognitive function difficulty with the hypotension. So we didn't really go into that too much into the presentation, but usually I know in the hospital setting, when the patient is having low blood pressure, we usually give the person fluids to try to raise the blood pressure. And usually that helps. And if that doesn't help, there are other medications that can be used to raise the person's blood pressure as well.
Okay, thank you very much.
You're welcome.
Good evening. Question, if in monitoring for someone who is on medication. And if we are consistent in doing our reading, say three, I don't know, 3 times a week or so, and taking the medication, if we discover that maybe 2 days or 3 days consecutively, the pressure is kind of low because the
Mm-hmm.
medication, should you stop the medication and contact your physician or just continue? I mean, I'm not, if you're checking it and it's low today and you continue the medication, it's low again. Is that cause for concern? I mean, lower than it should be.
Okay, thank you for your question. Good evening. With the blood pressure medication, sometimes the regimen or the combination of drugs that the person is placed on, they may eventually develop hypotension, especially if the blood pressure medication is being taken in conjunction with lifestyle changes. Now, in cases like that, if you notice that your blood pressure is getting low some days and it's asymptomatic, and it's not, you're asymptomatic and blood pressure isn't extremely low, then it's not a cause for concern. But if the person is in fact symptomatic, whether having the dizziness or any of the other symptoms, then they can call their doctor, let their doctor know what's going on, and they will determine whether they should discontinue the medications completely or if they should just cut back on, perhaps, let's say you're taking one particular medication, 20 milligrams of that. The doctor might tell you cut back to 10 instead of 20. Or if you're taking a particular medication twice a day, you might say, okay, take it once a day. So it really would depend. Again, it's case by case. So in some cases, they may, in fact, tell you just reduce it. In some cases, they might tell you to stop it completely.
Okay. Thank you.
You're welcome.
Good evening, all. Any other questions for Dr. Wright? Those were good questions and good Bahamian questions. And the key thing there is you just don't stop your medication on your own. I'll do some highlights. You contact your physician and get advice. As Bahamians, we tend to do it and say, oh, it's low. No need for me to take this. Let me just stop. And then the blood pressure do a rebound and shoot up, and you end up with a stroke or complications. So you don't want to stop it on your own. Seek medical advice. Any other questions? We have 1 more minute. We'll allow 1 more minute for questioning. Just wanted to make sure everybody got the basis of hypertension, what it was, if you're having any symptoms, what are some of the risk factors, and how you can treat it, and what you can do to prevent high blood pressure. So that was just the introductory. So you have a baseline for hypertension, and we will build on the lectures as we go forward.
Doc, another question. In your
Mhm.
presentation, you said that I guess Black people are highly prone to having hypertension as opposed to Caucasians and Asians. What do you think is the reason? Is it because of our dietary factors?
It's Thank you for your question. It's more so the genetics. Didn't really do too much research into exactly what genetic makeup and the African descent contributes to the development of hypertension in comparison to other races, but it is definitely more so genetic.
And being genetic can it be what is the word they said, like if I mean, can it be passed? I mean, if you have a parent who has hypertension, is it more likely that you will have hypertension?
Yes, it is. Studies have shown that if a patient has one or even both parents who are hypertensive, they are twice as likely to develop hypertension as someone whose parents are not hypertensive. So it definitely is something that may be passed on and throughout the genetics may be passed on.
Thank you.
You're welcome.
So, Deidre, I think the word you were looking for there is hereditary, and it is. As
Okay,
as
thanks,
Dr.
Doc.
Wright would have just said.
Sorry,
Okay, so
I'm
another
sorry,
question?
Doc. Yes, please. I just thought
Okay,
of
go
something.
ahead. Go ahead, Nuri. Go ahead.
Thank you. Um, how do you, how would you know if the medication that is prescribed for you is not doing what it's supposed to do? Are there any side effects that you should look for? Say you've just been recently diagnosed as hypertensive and your doctor makes a prescription.
Mm-hmm.
What are some symptoms that could arise that this is not the one or this is not the dosage for you?
Okay, thank you for your question. So with the okay, you want to know okay, that's the first part of your question. You asked how do you know this isn't the dosage of you for you? And the second part was the side effects. So with the in terms of how do you know this isn't the dosage for you, that would come in basically by doing monitoring your blood pressure at home. So if you're taking your blood pressure daily as prescribed and you're measuring your blood pressure daily, and if you notice that you're doing the blood pressure as you should, sorry, the medication as you should, and your pressure is still not controlled, then perhaps it's also important. I didn't mention this earlier. It's also important when you're doing your readings at home to keep a diary. So with every doctor's visit, you can bring your diary to your doctor and they will look at that diary to determine if the pressures are high, they'll determine that, okay, I need to increase the dosage or I need to add on another medication. If the pressures are too low, then they'll know that, okay, I need to decrease the dosage or take them off of one of those medications. So that's the main thing about knowing if it's the correct dosage is monitoring your blood pressure. In terms of side effects, most blood pressure medications, doctors would discuss it with the patient, but the side effects aren't really severe. Some blood pressures medications may cause a dry cough. When that happens, you could switch to another blood pressure medication. And other blood pressure medications may cause nausea or even drowsiness. So, in most cases, they aren't severe.
Okay, thank you very much.
You're welcome.
Hi, I have another question.
What do you do
Um,
about the medication? Those ones what they call diuretic. You got to go to the bathroom every so often.
Mhm. Yeah.
Yeah, that's getting laugh at that one.
Yes.
Go to the bathroom. I'm a hypertensive person, and I take the diuretics, and I still go into the bathroom.
Yeah, unfortunately, that's just one of the side effects of the diuretic. The diuretic basically works by increasing your urine production. So, unfortunately, there's no way around going to the bathroom so constantly with the diuretics. Even the diuretic, not related to blood pressure, But lemon is a diuretic as well. Pineapple, citrus fruits, they are diuretics, but it's just a side effect because that's how it works. Can't really change that. Yeah.
A side effect have you going to the bathroom 3, 4 times a night, and you know, all docs say if you don't get your rest, there's no healing.
Yeah.
Oh,
At the same time, if you don't take your blood pressure medication, then you end up with the negative effects of high blood pressure. So there's no real balance. Some things you just got to do, and diuretics, that's just how they work. The only thing we could do is monitor. We try not to put too high dose. We try to the smallest dose possible because we understand the inconvenience of getting up and, of course, not getting your rest. So please also note the time that you're taking the diuretic. You know, if you take it late, you're gonna be up all night. So take it at a time where you can take it, use the bathroom, but at the same time not too disruptive to sleep because not sleeping could also lead to high blood pressure, right? So
I hear you, doc. Soon as
you
I
need
get,
to try to make a balance.
Mhm.
yeah, I understand that, doc. But don't worry. First thing when I get up in the morning, I take them pressure tablets to try to avoid not getting up and like pain.
Exactly.
But it's not working anyhow.
What you want, if you don't mind sharing.
I am
License?
on the I
How
am
much?
on the co I am
Uh
on the what they call the codiavan.
huh. Which
So
strength? 160 what or 160 25?
I am on codiavan. What do you call this? The 320,
20.
Uh-huh. 12.
12.5, 12.5, and I be getting up.
Really? You're on a low dose of diuretic.
That's right.
That's a very low dose, so I don't know why that's doing that.
Mm.
Has it? Okay, take it early and see what happens. If it continues to do it, then when you visit your doctor, tell them they may have to put you on something else that may not be as disruptive. So just monitor it. But if it is keeping your blood pressure control, then they say if the car works, you don't. If it working, you don't fix it. So
Yeah,
you got to just may have to endure the
Mhm.
inconvenience of peeing plenty.
yeah. Okay.
All
okay,
right.
my last,
Yeah, but
my
that
last.
answers your question because Julie will give you a chance once MD is
Yeah,
finished.
that's you answered my question. Thank you so much.
Okay, no problem. Mr. Stank, Julie may turn to us. You may go ahead.
This is just the last one. In recording the readings, during the week, is it good to do your readings the same time in a given day? Like if you start your recording, like if you do on a Monday morning, and then you do like a Wednesday afternoon, and then on a Friday evening, is it good to just
Hmm?
keep a pattern? The kind of,
No,
is that important
I'm
or does it matter?
I'm getting people more relaxed to ask the questions.
That is a good question. So, when you're doing your blood pressure monitoring, you definitely should try to do it at the same time every day. Ideally, it's best to do it first thing in the morning before you take your medication, and last thing in the evening.
Okay, okay, okay,
So ideally, it's best to do it at the same time every day.
okay. Thank you. All right.
Now, when we have these good evening, and when we have these, um, I I know you said the normal um levels are 120 over 80. So
Mhm.
we have persons who are hypertensive, they're on medication. Sometimes their reading over, like, is there cause to be alarmed? Because they're above, but they're not.
Okay. I had a lot of breaking up there, but what I think
Hello?
I got the question. I think the question was, what if the number is like one number is normal and one is high? Was that the question?
Or just slightly above.
Or just
Like, let's say, because I'm reading somebody's um vitals in the morning,
mhm,
and sometimes the figures are like 127. It's supposed the bottom one is is a good um reading, as it's something to get alarm. The next
okay,
question
I'm
that
still
so might bring up the pressure.
my I still wasn't able to fully hear the question. It was cutting in and out. I don't know if it's something on my end, but I from what I was able to hear, I think the question was, is it something to be alarmed if the pressure, one is high, one is low? I'm not sure. But if there is a discrepancy with the systolic and the diastolic pressure, usually we go with the higher category. So if the top number is in fact normal and the bottom number falls into the elevated range, then you would say that the person's pressure, or even in the hypertensive range, you'd say that person has hypertension, even though one number is normal. And in some cases, persons may start off with having one normal number and then eventually one normal and one abnormal or high number, and eventually they might develop full-blown hypertension where both numbers are persistently elevated. So it's something that can be watched, monitored, and if the physician feels the need to increase the medication or adjust, they can do that based on that reading. Hope I answered the question.
Thank you. But I was also too concerned about my knees. You can hear me better. Can you?
Deidre, maybe you can type the question because we're
Happening.
not hearing you.
Yeah, I didn't get that last question.
Good evening. Once while Deidre is typing a question, if anybody else have a question, you go ahead and ask.
Dr. Wright, I don't know if you're seeing the question. Is magnesium a good supplement for lowering blood pressure?
Oh, I didn't see it. Um, yes, in some, well, when I discussed the DASH diet earlier, and thank you for the question. When I discussed the DASH diet earlier, I mentioned that the DASH diet is rich in foods that are high in calcium, magnesium, and potassium. So magnesium actually is a good supplement to help with lowering blood pressure, but supplements are not as good as getting directly from the food source. But if the food intake isn't sufficient to meet the required magnesium, then definitely magnesium can be taken to supplement medication or daily lifestyle changes. But of course, magnesium levels would still have to be, it would still be measured with routine blood studies to make sure that the person isn't taking too much magnesium, because that can cause its own set of problems.
Seeing that nobody else have any question, this another one for me. Would you recommend I on a kinda I would say low dosage medication for the hypertension and I know if you're doing a diet or fasting you should take your medication.
Mm-hmm.
And but if I want to do a alternate day fasting, um, and I decided that I can eat today and don't eat tomorrow, would that be safe to still take the medication on empty stomach?
It's a good question. In terms of fasting, now some medications you have to look to see on the box. They usually would have it as to if the medication requires food. Some medications require to be eaten with food, and the reason for that is number one, the medication in the stomach alone can actually damage your stomach and irritate the lining of the stomach. Number two, sometimes if there isn't any food, the medication may actually be absorbed too quickly. It might go through the body too quickly. So it is important to eat certain types of, sorry, not eat, take certain types of medications with food. So on a case like that, I would advise to talk to your physician about that to determine if the medication you are on needs to be taken with food or not.
Okay, thanks. Okay.
And just to elaborate on that a bit, medicine is never one shoe fit all. Everybody have to fit their own shoe. So medicine is a very fluid um, environment, changes, and it's personable to the individual. So it's never one shoe that fits all. And the same for medications, etc. So if there are no other questions for Dr. Rhodesha Wright, we'll invite Dr. Wright at this time to do any closing remarks that she wanted to before we have a final conclusion, and then we will then just highlight the lecture series for June 2022. Dr. Wright?
Okay, thank you. I would like to say thank you for everyone that tuned in this evening. I appreciate it. Everyone's questions as well. And I appreciate the interaction with with the presentation and about the presentation. I trust that the information that I shared tonight was memorable and it gave you all a good overview of hypertension, and you'll be able to apply any of the knowledge that you got from this presentation into your day-to-day to help monitor if you or control if you do in fact have hypertension, or if you're currently trying to control your hypertension. So thank you all.
And we want to say thank you, Dr. Wright, on the job well done. Very good, thorough presentations and the question and answer period as well. Thank you so much for your presentation. And we look forward to other presentations that you will do during the course of our monthly health lecture series. So,
Thank
on
you.
that, congratulate yourself, parishioners who in. Spread the word, please. We're doing this monthly on Mondays at 7. The next lecture series will be held in June 2022, so look out for the digital notice. That'll be our Pediatrics Corner, where the Department of Peds, Sudan's Department of Peds, will be presenting a topic, a pediatric topic. So you can listen out for the topic as well as the presenter and the exact Monday. The time remains at 7 p.m. So spread the word for us, please. And of course, if you have any questions concerning hypertension, I'm sure Dr. Wright wouldn't mind you reaching out to her and to ask, or any of the physicians in the church. We are here to assist to make sure that you get the best health care for best health outcomes. Not only for Sudan, Sudan spread the word and it goes, so leads to a healthier nation. So with that, I would say good night to all and look out for the next lecture, monthly health lecture that's coming up June 2022. Good night
Good
to
night.
all, and
Good
thank you
night.
so much.
Thank you.